Okay, hi folks, thanks for tuning in once again today. I'm just going to show you something quick and easy you can do. It gives you a basic idea on the difference between hip mobility and lower back mobility in regards to a lying leg raise. So first up, I'm just getting my client here, Rebecca, to raise her left leg actively, as high as you can go. So about, 80-85 degrees there, back down. This time, I want you to get your fingers, put them behind, so in the small of your back. See your lower lumbar area. And this time I want you to raise your leg and only go as far to the point where you feel your pressure from your lower back is pressing on your fingers. So about there. So you can see there's quite a difference between that, so it's about 45, and the first test, so the first test was getting up around 85 degrees. So what's happening there, in the first test she was compensating to get that leg up higher. So to get that leg higher, the lower back was flattening out as the pelvis was posteriorly tilting to get that extra range of motion. So it's something to think about when you're doing your dynamic warm-up. So say doing a set of 10 to 12 leg raises in your warm-up, also with incorporate with your mobility training as well, is where you're actually getting that range of motion from. So don't sort of lay in there and willy-nilly just throw the leg back and forth. Actually think about where that's coming from, and don't let your lower back cop all that punishment, because you've got a flexibility issue through your hamstrings. So that's a tip you can use, guys, if you want to do it yourself or get somebody to assess you as well. Now, with the straight leg raise test, this is a different sort of thing. So with this one, you'll need somebody to assess you with this one. This one I want to actually posterior tilt that pelvis a bit and flatten out, so that lower back and sacrum is flat on the table. And I'm just going to passively, so just relax that leg, take that through that range, make sure that lower back and sacrum are flat. So I can see the opposite leg is lifting. So I take that to that point of bind, and there's a bit of compensation. I'd gather going through the single joint hip flexors, so iliacus and psoas, but then once again I'd have to do something like a Thomas test to assess those hip flexors to determine that issue. But to make that a bit more of an accurate test, simply use a pillow or a towel in this case. I'm going to pop that other leg up and retest. So flattening that lower back. Get a bit more of an assessment there. So I'd like to see some more flexibility there. There's a few other compensations happening. But the problem arises in that circumstances where there is a bit of tightness through the single joint hip flexors, is the sheer fact is that the hips will already be in a flexed state. So it will give an inaccurate test score. That can also happen in the other direction, where there'll be an excessive posterior tilt, can give the test score, can be not accurate as well. So if there's excessive posterior tilt, I'll get a higher score than I would normally get. So you'd have to sort of assess those different things as well. But once you've determined there is actually a shortness with the hamstrings, you can stretch the hamstrings with a stretch band. Simply wrap it around the foot something you could do at home yourself. So okay, once it straightens up a bit. That's something you can do at home. You actually actively stretch those hamstrings as well. And you can hold that for, 10 to 15, 20 seconds, even longer. Or get somebody to help you as well, training partner. You can also incorporate your P&F stretching or your PIR stretching as well, so your post isometric releases, where you'll have a contraction of the muscle followed by a stretch, and you'll do that a few times until you actually get some improvements in the length of those muscles. Also, one thing to remember with your hamstring stretching is not do any stretching where you're actually crouching over, putting your spine into flexion. You're trying to focus on those hamstrings and those hip extensors through that region rather than, once again, compensate by leaning forward. So a stretch like that would be putting your leg on top of a bench, table, and leaning forward. So any sort of improvements I'm getting will be the result of me going into flexion through my spine, which is, I don't want that. So make sure you just focus on the hamstrings. So I can simply just lean forward from the hips. So that's going into flexion. As I'm going closer, I'm not flexing my spine, and I can feel that stretching through my hamstrings there, rather than get any excess through my spine, like so. So there's a few tips you can use, guys. Hope that helped. Once again, gives you a basic sort of idea to run through, but always seek the professional help and opinion from allied health professionals, or your local PT or a therapist that might be in your area. So once again, thanks. Catch you next time, and leave your comments below. And peace.